On behalf of my co-authors, I'm privileged to present results from a community representative survey entitled Missing Men or Missed Opportunity, Men's Frequent Use of Health Services in Malawi. We have nothing to disclose. HIV testing strategies for men need to be expanded. Facility-based testing offers sustainable, scalable solutions, characterized by capitalizing on existing health service infrastructure and high rates of ART initiation for those who test positive. However, facility-based services are rarely considered as viable strategies to reach men. Male-focused interventions usually target community settings because of a general assumption that men don't come to facilities. The idea is that in order to reach men, we must go to them. But is that true? There's little data supporting this claim. In this study, we asked the question, how often do men come to health facilities? And when they do come, are they offered HIV testing services? Examining the frequency with which men attend health facilities and whether HIV testing is offered or not is critical in order to understand the role of community and facility-based interventions for men. We conducted a cross-sectional representative community survey with men in Malawi. Surveys were conducted with individual men and relied on men's self-report to measure all outcomes of interest, including primary outcome of men's attendance to a facility in the past 12 and 24 months, and the secondary outcome, HIV testing during any facility visit within the same time period. Men were eligible if they were between 15 to 65 years of age, never tested HIV positive, current residents of the study village, and spent at least 15 nights in the village during the last 30 days, meaning that they were actively present within the village. We used a multi-staged sampling design and purposefully selected 2 districts and 3 mid-level facilities per district, resulting in 6 facilities in total. We then randomly selected 6 villages per health facility, with 36 villages in total. Using household census data, we randomly selected 40 individual men per village, with around 1,400 men in total. We stratified our individual level sample by age category, so we had roughly equal numbers of young, middle, and older age men. And I'll describe these categories in more detail shortly. Here's a map showing the multi-stage design for our sampling frame. Randomly selected villages were a mean 5 kilometers distance from their catchment health facility, a distance to be expected in Malawi. This figure shows study enrollment. What's important to note here is that of the 1,473 men recruited, only 95 men, or 6% of the sample, were not found, meaning that our sample is very representative of the population we were meant to capture. A total of 1,116 men are included in the analysis. Here we present demographic data for all male respondents. 69% of men were actively working, and a good proportion of men were mobile, with 27% sleeping at least 3 nights away from their home in the past 30 days. Importantly, 55% of men were in need of testing, defined as either never tested for HIV or tested more than 12 months ago. Young men were less likely than middle or older age men to have ever tested. Here we present 2 Kaplan-Meier curves to understand men's attendance to health facilities in the past 12 and 24 months. Figure A shows facility attendance among all male respondents, and we disaggregate by our age categories. Here we see that 80% of all men visited a health facility in the past 12 months and 90% of men in the past 24 months. Figure B shows facility attendance among men in need of testing, again defined as men who have never tested for HIV or have tested for HIV more than 12 months ago. Here we see that 65% of men in need of testing attended a facility within the past 12 months, and 82% attended a facility in the past 24 months. Facility attendance was similar across age categories. When examining men's most recent facility visit, we see that the vast majority of healthcare visits were to the outpatient department instead of in the inpatient department, antenatal, or children under 5. And we see a quarter of most recent visits were as a guardian, meaning that the men attended a facility in order to support someone else's use of health services, not for their own health care. About half of men who attended a facility tested for HIV in that same 12-month period. We then looked at the most recent healthcare visit among men in need of HIV testing. Here we find that basically all men's most recent visit were to the outpatient department at 96%. 41% of men's most recent visits were as a guardian, supporting someone else's use of health services. Importantly, only 7% of men in need of testing were offered HIV testing at any facility visit in the past 12 months. This represents a major gap in provider-initiated testing. When asked why men didn't test for HIV during their most recent visit, 45% reported that it was because they were not offered. This figure visualizes the gaps in facility-based testing. We see that the majority of men in our sample attended a health facility. However, only a portion of those were offered testing. Most who were offered testing did test for HIV that same day, as evident by the visible pink area in each respective age group. The visible dark blue area represents the maximum impact that increasing facility-based testing could have. The gap is greatest among young men, followed by older men. Our findings challenge prominent narratives that men do not attend health facilities. Men are frequenting health facilities, and the overwhelming majority of men attend outpatient departments. A surprising portion of men attend health facilities as guardians. These findings provide important insight to any health service intervention trying to reach men. The majority of men can, in fact, be reached during routine health visits they are already making. However, we find that there is still a significant gap in provider-initiated testing among men attending health facilities. Additional research is needed to assess if similar findings exist in other settings. As we continue to think about innovative ways to reach men, these findings challenge us to examine our assumptions about men and their engagement with health facilities. Our findings indicate that men can be reached through facilities simply by ensuring that all men are offered the opportunity to test. I want to thank our funders and thank you for your time.